The Department of Health has announced in the last half hour that 14 more people across Britain have died after testing positive for coronavirus. It brings the total number of deaths here in the UK so far to 35. The Health Secretary for England, Matt Hancock, has warned that the measures the government would take to combat the coronavirus will disrupt the ordinary lives of almost everybody in the country. He confirmed that in the coming weeks, people over the age of 70 and other vulnerable people will be asked to self-isolate. In other words, staying at home and cutting down on their contacts with others. The Department of Health says they'll put out more guidance tomorrow on what social distancing measures elderly and at-risk people should take. Here are the day's other main developments. Well, in total now, 1,372 UK cases have been detected of coronavirus. That's people who have had a test and the test has been positive. Over 40,000 people have been tested in all, so the rest have proved negative. Matt Hancock said ministers would ask the nation's manufacturers to switch to the production of ventilators needed to treat people who develop severe symptoms. More doctors would be trained in their use. In the last hour, the chair of the construction company JCB said he'd been approached to help by ministers. More doctors would be trained in their use too. Supermarkets in the UK are urging customers not to panic buy during the outbreak. And the Foreign Office has advised against all but essential travel to the United States following the US government imposing restrictions on travel from the UK. The Foreign Office is also advising against all but essential travel to Spain and the Balearic and Canary Islands. EasyJet is the latest airline to cancel all of its flights to Spain. That comes into effect from Tuesday. Ryanair is also limiting the number of its flights to the country. Here's our political correspondent Nick Eardley.
For weeks now, we've all been told to wash our hands more, but the government is increasing its response to coronavirus. Already, if you've got a persistent cough or fever, you're to stay at home, and new measures could be coming soon. Many of them will be focused on those most at risk, in particular the elderly. They could soon be asked to shield themselves from the virus by staying away from other people for months.
Protection of the vulnerable and elderly by asking them to stay away, to stay at home. That is in our action plan, but we do not want formally to say yet that people should do that. And the reason for that is simply this length of time that they'd need to stay self-isolated, stay at home to protect themselves. It is a very big ask. It's a very long time.
The Scottish Government says its plans for the elderly focus on reducing contact rather than complete isolation. But soon, families are likely to be asked to isolate together too if someone in a household shows symptoms.
It's an oxylog.
Engineers will be asked to produce as many ventilators as possible. The government needs more and has said it will buy as many as can be produced. There are also plans to take over beds in private hospitals if the NHS comes under too much pressure.
I think that this response is going to be one of the biggest challenges that our generation faces.
Some questions are being asked about the response though, including about the idea immunity can be built up by protecting the most vulnerable while others get a mild illness. Ministers say that's not the plan, despite the government's chief scientist suggesting it was part of the approach. Labour wants more information about how decisions are being reached.
We do that not to undermine the government because we want the government's strategy to succeed, but we think it's important that we can all reassure ourselves that the government is taking the correct approach.
Engineering the antibodies.
The Prime Minister is holding talks with officials this afternoon. Emergency legislation will be published in the coming days and new measures are likely to be introduced soon. Nick Eardley, BBC News.
And Nick's colleague, political correspondent Jessica Parker is here. Afternoon to you, Jessica. Let's start with what we do know is that there will be some kind of announcement tomorrow about social distancing. Do we have any indication as sort of what parameters the government's looking at? Because some of the measures in other European countries have been pretty dramatic.
Yeah, I mean, I think it's important to talk about the difference between social distancing and self-isolation. So obviously we've been hearing this morning from the Health Secretary, Matt Hancock, this idea that over 70s, elderly, vulnerable, within weeks there could be some move to ask them to self-isolate. Social distancing is a less radical step, but it is about reducing your contact day to day with people in order, of course, to reduce your chance of getting the virus. So we've had guidance that we could get more on that tomorrow. In terms of the advice for elderly people, there is a COBRA meeting tomorrow, going to be chaired by the Prime Minister. So I think we'll expect some communication, maybe some further guidance out of that. I think more broadly, looking at what's happened over the weekend, and there have been dribs and drabs of information, there have been accusations that it's caused confusion. I think pressure is building on Downing Street to maybe take a bit more control of the communication.
To make it more structured, more predictable when you're going to hear things.
So that people know where they are on a day-to-day basis, and to stop speculation. Because obviously people are feeling very worried and very scared.
Yeah, and understandably so. I mean, we see the death toll going up again. It's entirely what was predicted. There's no great surprise in the numbers, but every figure is an individual case. Everyone is a family who have lost somebody they would probably not have been expecting to lose, certainly not in these circumstances. And there are all sorts of practical knock-ons, aren't there, of every decision government takes. For example, if they were to say, right, like Ireland, as pressure is coming from Sinn Féin in Northern Ireland, shut the schools, you immediately have all those kids who have to be looked after somewhere. That's probably at home. Mum and dad are working. It's the grandparents who are looking after them. And suddenly you increase the risk of vulnerability again.
Or
there's no easy answers.
No, and if mum and dad are working and say there aren't any grandparents or it's not practical for obvious health reasons to do something like that, do mum and dad have to stop working? Do mum or dad work in the health service? What impact does that therefore have on care? So there are a huge number of knock-on effects and ramifications going forward. Northern Ireland is a particular case. As you say, there was a meeting yesterday between politicians in Northern Ireland and the Irish government about cross-border cooperation, but a bit of a difference in opinion as to when in Northern Ireland schools, colleges should close, given that is already happening in the Republic. So that is an ongoing conversation as well.
Some places only 1 mile apart.
Yes, exactly.
Parents go, well, hang on a minute, that family down the road, their kids aren't going to school, but you're saying it's fine for my kids to go to school.
Yes, so that's a particularly difficult issue that's playing out in Northern Ireland and the Republic of Ireland as well. I think it's worth saying, though, where some of this stuff started overnight in terms of isolation for the over 70s, for vulnerable people, was some advice that came out from the Scientific Advisory Group for Emergencies. There's this scientific group attended by the Chief Medical Officer, the Chief Scientific Advisor. They released some information yesterday saying that they thought the government would soon need to move towards two things: shielding, which is the term that covers social distancing or people staying at home on the more radical step, but also household isolation. That's been slightly lost as well. Household isolation being if one person in a household starts to show symptoms of the coronavirus, the whole household then stays at home and self-isolates for a time.
And there's a sort of logic to that, isn't there? But again, that has a huge
impact, exactly. Now, maybe we'll hear more from the government this week as to what extent they are moving towards that. As we were talking about earlier, emergency legislation is expected to be published as well. So I think there will be some more clarity, but not only that, there is pressure for there to be more clarity.
Jessica Parker, thank you.